PSC NURSE പുതിയ വീഡിയോയിലേക്ക് സ്വാഗതം. മെഡിക്കൽ സർജിക്കൽ നഴ്സിംഗ് എൻഡോക്രൈൻ സിസ്റ്റം 56 ചോദ്യങ്ങളും അവയുടെ ഉത്തരങ്ങളും ഈ വീഡിയോയിൽ ഉൾപ്പെടുത്തിയിരിക്കുന്നു. വീഡിയോ കാണുന്നവർ ചാനൽ സബ്സ്ക്രൈബ് ചെയ്യുവാൻ ശ്രമിക്കുകയും ഫ്രണ്ട്സിന് ഷെയർ ചെയ്യുകയും ചെയ്യുക. നിങ്ങളുടെ വിലയേറിയ അഭിപ്രായങ്ങളും നിർദ്ദേശങ്ങളും കമൻറ്റ് ബോക്സിൽ രേഖപ്പെടുത്തുക. വീഡിയോ ഇഷ്ടപ്പെടുന്നവർ ലൈക്ക് ചെയ്യുകയും അല്ലാത്തവർ ഡിസ്ലൈക്ക് ചെയ്യുകയും ചെയ്യുക. പഠിക്കുന്ന എല്ലാവർക്കും ഞങ്ങൾ വിജയാശംസകൾ നേരുന്നു. വീഡിയോയിലേക്ക് കടക്കാം. A tumor occurring in adrenal medulla causing hyperactivity of the gland secreting catecholamine of chromaffin cells of sympathetic nervous system. Pheochromocytoma. Tumor occurring in adrenal medulla which is malignant cells resembling a neuroblast is dash. Neuroblastoma. Dash is defined as oversecretion of one or more of the hormone secreted by the pituitary glands. Hypopituitarism. Abnormal milk secretion is dash. Galactorrhea. Dash is deficiency of one or more of the hormones produced by the anterior lobe of the pituitary. Hypopituitarism. Dash condition results when both anterior and posterior pituitary fail to secrete hormones. Panhypopituitarism. Dash is a diagnosis of diabetes mellitus that applies only to women in whom glucose intolerance develops or is first discovered during pregnancy. Gestational diabetes mellitus. Dash is a chronic systemic disease characterized by either a deficiency of insulin or decreased ability of the body to use insulin. Diabetes mellitus. Presence of glucose in urine is dash. Glucosuria. Medical term for elevated blood glucose level is dash. Hyperglycemia. Presence of ketone in urine is dash. Ketonuria. Presence of protein in urine is dash. Proteinuria. Loss of subcutaneous fat is dash. Lipoatrophy. Fat metabolism disturbance leading to loss of subcutaneous fat is dash. Lipodystrophy. The process by which liver converts its glycogen stores back to glucose is called glycogenolysis. The process by which liver increases the biosynthesis of glucose is dash. Gluconeogenesis. A condition in which patient with diabetes ketoacidosis experiences severe acidosis making the diabetic inclined to loss of consciousness is called diabetic coma. Metabolic acidosis developing from acidic effect of the ketones acetate and beta hydroxybutyrate is called diabetic ketoacidosis. Patients with diabetic ketoacidosis experience respiration with an increased rate or depth and is called Kussmaul's respiration. DASH syndrome variant of diabetic ketoacidosis characterized by extreme hyperglycemia, profound dehydration, mild or undetectable ketonuria and absence of acidosis. Hyperglycemic hyperosmolar non-ketonic syndrome HHNS. DASH refers to a syndrome in which people with diabetes are unaware that they are hypoglycemic and therefore do not initiate treatment. Hypoglycemic unawareness. Hypoglycemia followed by rebound hyperglycemia is known as Somogyi effect phenomenon. DASH refers to an early morning rise in blood glucose level without preceding nocturnal hypoglycemia. Dawn phenomenon. CHIO stand for hypertension, adult onset diabetes, obesity and stress CAD. Most common chronic complication of diabetes is neuropathy. Inflammation of the pancreas is pancreatitis. Stone in the gallbladder are called cholelithiasis. Bluish discoloration of the left flank is Turner's sign. Bluish discoloration of periumbilical area is dash Cullen sign. The procedure pancreatic duodenectomy is also called Whipple's operation. DASH is a hereditary chronic disease characterized by abnormal secretion of exocrine gland. Cystic fibrosis. X-ray study of bile duct is dash cholangiography. Inflammation of bile duct is cholangitis. Removal of gallbladder is called cholecystectomy. Inflammation of gallbladder is dash cholecystitis. X-ray study of gallbladder is cholecystography. Incision and drainage of gallbladder is cholecystostomy. Stone in common bile duct is called choledocholithiasis. Exploration of common bile duct is choledocostomy. Obstruction of common bile duct is choledocholithiasis. Radionuclide imaging of biliary system is called cholecystoscopy. Collection of pus in pleural cavity is dash emphysema. A sign denoting inflammation of the gallbladder where continuous pressure over the organ will cause the patient to catch breath at zenith of inspiration is dash Murphy's sign. Analgesic contraindicated in a patient with Murphy sign positive is dash morphine. Dash is a inflammatory disease of the bile duct and causes fibrosis and thickening of their walls and multiple short and concentric structure. Sclerosing cholangitis. Yellow pigmentation of sclera, skin and deeper tissues caused by excessive accumulation of bile pigments in the blood is a characteristic of a disease called jaundice or icterus. Dash is due to defective uptake, conjugation or transport of bilirubin by the liver. Hepatocellular jaundice. Inflammation of liver is dash hepatitis. Covering of the liver is dash Glison's capsule. A group of dilated capillary blood vessels, web-like or radiating form seen in patients with liver cirrhosis is called dash spider angioma or telangiectasia. Dash of the liver is chronic progressive disease characterized by widespread scanning and nodule formation. Cirrhosis. Alcoholic cirrhosis is also called as Leydig cirrhosis or micronodular or portal cirrhosis. Dash exists when there is persistent increase in BP in the portal venous system. Portal hypertension. Dash is a localized collection of pus and organism within the parenchyma of liver. Liver abscess. An iron containing pigment derived from hemoglobin breakdown and away iron is stored until needed for hemoglobin synthesis is dash hemosiderin. Dash is characterized by dilated bile duct cyst formations. Caroli syndrome. Thanks for watching. PSC NURSE വീഡിയോ ഇഷ്ടപ്പെടുന്നവർ ലൈക്ക് ചെയ്യുകയും ഫ്രണ്ട്സിന് ഷെയർ ചെയ്യുകയും ചെയ്യുക. നിങ്ങളുടെ അഭിപ്രായങ്ങളും നിർദ്ദേശങ്ങളും കമൻറ്റ് ബോക്സിൽ രേഖപ്പെടുത്തുക. വീഡിയോ കാണുന്നവർ ചാനൽ സബ്സ്ക്രൈബ് ചെയ്യുവാൻ ശ്രമിക്കുക. വീഡിയോയിൽ ആൻസർ പറയുമ്പോൾ ഗ്യാപ്പ് ഇട്ട് കൊടുക്കുന്നുണ്ട്. അത് നിങ്ങൾക്ക് വായിച്ച് മനസ്സിലാക്കാനുള്ള സൗകര്യത്തിനു വേണ്ടിയാണ്. നന്നായി പഠിക്കാൻ ശ്രമിക്കുക. പഠിക്കുന്ന എല്ലാവർക്കും ഞങ്ങൾ വിജയാശംസകൾ നേരുന്നു. നന്ദി, നമസ്കാരം.